Hello, I'm Dr. Sam, this is Dr. Sam's Health, and I continue talking about the COVID-19 pandemic. Today will be a special video because I've been talking about the statistics around this virus, about the general aspects of the virus, about different research studies, about the pandemic weight loss. Today I would like to talk about the ways to end it. As you can imagine, and I guess as everybody else, I've been watching lots of presentations, press conferences, reading a lot on this virus. I've seen different opinions from different kinds of people like scientists, researchers, clinicians, public health officials, politicians, and obviously I've been watching the statistics on this virus, how it propagates, how many people will have infected and dying in different countries, and what kind of public measures they take to prevent the propagation of the virus and prevent people from dying. So in the end of the day, after all this watching, reading, listening, I have formulated my own mental model of this virus and this pandemic, and based on this model, I would like to suggest 4 public health measures that can and should, in my opinion, be taken in order to mitigate the harm coming from this virus, both from a medical standpoint and from socioeconomic standpoint. As usual, before I begin, I would like to make a couple of disclaimers. First of all, I'm not an infection disease specialist, I'm a psychiatrist and a researcher, but at the same time I admit that I might not know everything, and in the end of the day I might be simply wrong about something. So please take my opinion with a grain of salt. It is just my educated opinion, but I'm making it in good faith. The second disclaimer is related to the fact that I'm a practicing physician and I'm expressing my opinion, but I don't want you to take this video or thoughts that I'm expressing as medical advice. If you need medical assistance, please go to a family doctor or to emergency room if you are experiencing some sort of a medical emergency. And the final disclaimer is related to the fact that I belong to several professional bodies, and the opinions that I express on my YouTube channel or on my blog, check it out, drsamshealth.com, they have nothing to do with the opinions or statements that I expressed by my professional bodies or WHO. I do not plan to contradict their statements, and I'm pretty sure that my opinions do not differ much, but I would like to emphasize the fact that my blog and my YouTube channel are solely mine, and they represent only my own opinions. Again, made in good faith. So now when we're done with disclaimers, we can talk about the 4 public health measures that in my opinion will help us tremendously. The very first step, or the very first measure, is protecting the vulnerable. By vulnerable, I mean elderly people, immunocompromised, people who have multiple medical and psychiatric comorbidities, and all these comorbidities, their age, their immunocompromised status, they make them much more vulnerable to this virus. We know for sure that if these people are exposed, they are much more likely to contract the virus and much more likely to suffer from this virus and even die. So the very first step that, in my opinion or in my observations, has already been made more or less in the majority of cultures, we have to protect the vulnerable. How are we going to do this? The answer is making sure that these vulnerable people are not exposed to the virus, or minimizing the risk of exposure as much as we can. We can isolate certain categories of people willingly, of course. We can use personal protective equipment. We can sanitize multiple surfaces, places, making sure that people are being screened before entering medical buildings, keeping our physical distances, and so on. I'm pretty sure that in your environment, all these steps have already been made, but at the same time, I would like to emphasize that these steps are absolutely necessary no matter what we do further on. Unless we have a vaccine or effective treatment for this virus, these steps have to continue. And that brings me to the second measure, which might sound a little bit controversial. What I'm suggesting is gradually, slowly, scientifically, incrementally reopening the economy, step by step. And I said it will sound controversial because a lot of people might feel that I'm arguing for reopening everything at the same time. I would like to clarify that it's not what I'm arguing for. What I'm arguing for is deep analysis of what we have done to this point, what different countries have done, what kind of measures they have taken, what kind of businesses we can reopen right now, and what kind of people we can effectively allowed to return back to work, in what capacity, and how we can mitigate their chances of getting serious cases of COVID. And I've got at least 3 good reasons for reopening the economy. Again, slowly, scientifically, gradually, incrementally, cautiously. The first reason is purely medical. We all are trying to save lives by staying at home, keeping things in lockdown, minimizing all our interactions, but while saving lives this way, we are likely affecting the mortality rates for the next several years in several ways, because people are not getting their necessary medical procedures done. There are lots of elective surgeries that have been cancelled. There are lots of tests, including screening for cancer, that have been cancelled. There are lots of medical facilities that they cannot operate. There are lots of assessments and tests that are not being done, which all eventually will lead to the fact that the general health of the population will decline, people will live shorter lives, and their quality of life will decrease. And these are the things that we're going to observe in the next month and effectively years to come. The second reason is socioeconomic. Our economy is going to collapse if we continue with very strict lockdown. Moreover, lots of people are going to lose their businesses, their dreams, their jobs, and there are lots of tensions and psychiatric issues that are going to emerge. People will apply for disability, people will get depressed, people will get anxious, people are going to kill themselves, doing extended suicides and doing a lot of things that we don't want them to do. Generally speaking, again, it will kind of circle back to the fact that the quality of life of our people will decrease, that the life expectancy will decrease, we'll have lots of suicides, we'll have lots of people who cannot work, and effectively we will ruin our economy and we will ruin our healthcare, and we will ruin the health of the population if we continue with very, very strict lockdown. And the third reason is herd immunity. Likely you have heard the term. The idea behind herd immunity is that when the vast majority of population have already contracted certain infectious agent, certain infectious disease, they develop immunity to this, and effectively they start being a protective barrier between this disease and those who are more vulnerable towards that. So the virus doesn't spread from these people because they manage to fight it off and to destroy it using their own immune system. So as a whole, we are becoming immune. Though certain members of the society, hopefully the most vulnerable ones, have never been exposed to this virus. And therefore, I believe that if we start reopening our economy very carefully, very cautiously, scientifically, we will expose a lot of younger, healthier, less vulnerable individuals to this virus. And accordingly, these people will be able to form this herd immunity and protect those who are much more vulnerable. I hope at this point you see that I'm not suggesting anything controversial, and I hope that you see my reasoning and why I think that the reopening of economy is actually one of the most important measures we can take in order to mitigate the harm coming from this virus. Okay, the third step is increasing the capacity and the level of preparedness of our healthcare system. The whole idea of the flattening the curve initiative was based on the assumption that if we do not do this, a lot of people will contract the virus and a lot of people will get seriously sick. And all these people will rush to the hospitals and they will start infecting each other, and eventually they will overwhelm the healthcare system, which will lead to disproportionate number of deaths due to COVID-19. I'm very grateful to everybody who had contributed to the flattening the curve, and actually check out my YouTube video on that. I've been talking about the reasons and the things that this flattening the curve initiative might do for us. But at the same time, I must say that at this point we have already flattened the curve, and we cannot actually continue doing it forever, and that's why I believe that we should start reopening the economy. But at the same time, we might have the second wave of people getting the virus and accordingly going to the hospitals. So that might be very problematic, and in order to prevent this, we should still keep being very cautious about that. But also another thing that we can do is we can increase the capacity of the hospitals. We can increase the number of beds, we can increase the number of personal protective equipment, ventilators, we can work on training staff and increasing the capacity of specialized units. We can work on our vaccines, we can work on our treatment protocols. There are lots of things that our healthcare system can do to prepare itself better for a potential second wave, if there is one. And finally, I've got the fourth step or measure that we can all take together in order to mitigate the harm from this virus. If you noticed, I've been talking about people who are much more vulnerable to this virus, who are elderly, people who are having multiple health issues beyond their age, people who are immunocompromised, and I've been talking about people who are much less vulnerable to the virus, who are younger, healthier, and accordingly they are much more likely not to die from this virus and not to have it in a very serious form. So based on that, my fourth suggestion is to work on our own health, making sure that we are not vulnerable to this virus. We know that there are certain predictors of dying from COVID-19, and the two main ones are age and obesity. Definitely we cannot do anything with age, but we can definitely work on weight loss and all the conditions that are associated with the increased body mass index or weight, like high cholesterol, diabetes type 2 specifically, hypertension, polypharmacy, which means that a lot of people are taking multiple medications. These are all things that we can work on. Actually, I've made a video about the pandemic weight loss. Please watch it. I hope you will enjoy it. Actually, speaking of weight loss and diet, we should in general take care of our nutrition at this point of time, because nutrition determines how much of micronutrients we receive, like vitamins and minerals that are necessary for maintaining a strong immune system. That is totally in our control right now. Other things that we can do, again, we can keep our risks of contracting the virus low, or the viral load low. We can keep distancing from other people, using masks, using any kind of personal protective equipment, sanitize things and surfaces in our environments. We can also exercise to increase our resiliency. We can work on stress inoculation, because stress is one of the factors that actually lowers immune system. There are plenty of things to work on, and I hope that my little speech here will help you to actually try to sit and identify all these items on your list that you can do to improve your own health and to make you less vulnerable to this virus. So these were my 4 ideas. Once again, I admit that I'm not perfect. I might be wrong about something or about everything. Always feel free to leave comments on my YouTube channel. Check out my blog. I've got these ideas like better organized there. drsamshealth.com is the website. Also, always feel free to leave comments, ask questions. You can argue with me. I hope that we can have a civil and nice discussion about pretty much anything you want. So stay tuned, subscribe to my channel, and I will see you in my next video. Stay strong, all the best.